Hi everyone, welcome to researchmd.com. We got another great presentation today. We're going to teach you everything about flow volume curve interpretation in restrictive lung disease. Again, my name is Pramil Cheriyath. I work as a program director, internal medicine residency program, transitional residency program. I'm also director of research, and I do teach medical students and medical residents, and I'm also professor at assistant professor of medicine at Hackensack School of Medicine. So let's jump into what method we got this. We're going to use three significant curves and teach you all about restrictive lung disease. Again, remember, we have this three curve method to teach you about pulmonary function or flow volume curve in restrictive lung disease. Okay, let's look at some numbers. Functional residual capacity, you can run from anywhere 1800 to 2200. You got total lung capacity, which is like everything inside our lungs. And there's vital capacity, which we take a deep breath and blow all of it out, and then expiratory reserve volume. We got inspiratory reserve volume. Then we have residual volume, which is what remains in the lung after we exhale everything out. There is like residual volume, what remains in the lung. Okay. Now just jump into the curve number one. We should know this curve very well. This is the tidal volume, vital capacity. We already discussed it, and we got a total lung capacity. Whatever, if you had everything inside, that is total lung capacity. Let's go through again. Tidal volume, right? And then you got vital capacity, expiratory reserve volume, functional residual capacity, and residual volume. Okay, so make sure you draw this a couple of times and start writing down each one. Inspiratory, where is the inspiratory volume? Where is the expiratory reserve volume? Where is the functional residual capacity? It will help you before we go to the next curve. Okay, so we got in that first curve, the most important thing I want you to look at is the residual volume, vital capacity, and the total lung capacity. Okay, now let's look at our flow volume curve. This is a normal curve. We got volume on the x-axis. On the y-axis, you got the flow, and you got the residual volume, what remains inside the lung. And then you ask the patient to take a deep breath, and the bottom is the inspiration, and they breathe in and then go up and then blow it out. So lower is inspiration, upper we got the expiration. So we have documented the vital capacity, and then you look at the TLC also in the lung. Okay. Now let's, in abnormal, what happened to the curve in the restrictive lung disease? You can see the curve is going to shift to the right a little bit because there is a decreased residual volume. There's decreased vital capacity. That means also our total lung capacity is going to be decreased. Okay, so remember three parameters. Residual volume is going to be decreased, forced vital capacity is going to be decreased. When you have both of them decreased, of course your total lung capacity is going to be decreased. And the peak flow is also decreased, and the curve is shifted to the right. Now, let's look at the third curve. In this curve, we got the time on the x-axis and the volume on the left axis. And we're just kind of looking at the FEV1 FVC ratio in restrictive lung disease, what's going to happen. So the normal FEV1 is around 4.2 liters, FVC is 6 liters, FEV1 divided by FVC, 4.2 divided by 6, you got like 70%. Okay, now what happened in the restrictive lung disease? Of course, there are some changes in the restrictive lung disease. If you look, our FEV1 decreases, at the same time FVC decreases. Okay, so in your calculation, FEV1 come to 3 liters, FVC also decreased to 4 liters. So the ratio pretty much remains the same, but there is a decrease in FEV1 and decreased FVC. Okay, so remember, all three curves are very important for us to learn. Again, thank you so much. We'll be back with another great topic for you next time. Please subscribe to our channel so it will help us to make more videos like this. Thank you again.